Podcast. Welcome to our Christmas special podcast. My name is Naaman Joker Anderson, and I'm joined by my fellow host, Joe McNamara.
Hi everyone.
So Joe, happy Christmas.
Yeah, happy Christmas. What a fun 3 months it's been.
It has, yeah. For anyone watching this on the YouTube channel, we have got our Christmas jumpers on. And if you can see in the YouTube thing, I've got Greg Wallace in the back with me.
And
He's
I've
all
got
festive
lots
and
of
ready to
jingle
go.
bells.
So yeah, I'd like to say a huge thanks to you, Joe, just for joining with me for the podcast a few months ago. We've had so much engagement and positive feedback. And yeah, it's a huge thank you to all of our listeners from across the world. So I think we were going through this earlier, and we've had over 2,500 listens, over 15 countries worldwide now, and we're in 6 out of 7 continents. So that's patients, students, healthcare professionals, all from different backgrounds. I know Antarctica will be tough as the 7th continent, but we'll try, won't we, Joe? So we're also, before we were only on Spotify, but now we're on, I think, 19 or 20 podcast libraries across the world as well. And we're also top 13th radiology podcast in the world on a website called FeedSpot. So thank you to Anuj Agarwal, the FeedSpot founder, for this. So yeah, quite exciting, isn't it, Joe?
Yeah, really exciting. And just to note, we didn't pay for that to be the top 13.
Yeah, that's true.
It was by a board of experts that listened to radiology podcasts, so that's really nice. But yeah, it's been really exciting, and I don't think when I said, "Oh yeah, I'd love to do that," that I necessarily thought A, it would be so much work, and B, that we would get so much engagement. I think you and I have worked together for a long time now, digitally and remotely, but I think it's been really nice just to see some of the impact that a podcast can have. And I know that that's what we always set out to do, was to ultimately make a difference, whether that be to a patient or to a therapeutic radiographer looking at their continual professional development, students thinking about what they need to learn, how they need to use the patient voice to kind of help support some of their learning. So I think we've kind of achieved that, but there's still a long way to go as well. So, but really exciting, and thank you for letting me be part of it, because it's great.
I didn't think you'd say no anyway.
Well, anyone that I said, "Oh yeah, I'm doing a podcast," they're like, "Of course you are."
Well, as we've discussed with quite a few of our guests, we're both quite passionate about what we do, and as you say, we want to make a difference. So that's it. But before we go any further, I thought, because it's Christmas, we could do a little quiz. I've got, I think, 5 questions I'm going to ask you.
Oh God. Okay. Is this about radiotherapy? Because as my husband says, I know a lot about a very small topic, which is cancer. Anything out of that, I know nothing.
And this is what's not. So I have to say thank you to my fiancée, Katie. So she used 3 of these questions in some of her quizzes in her work. So question number 1, Joe. What is the largest Christmas gift ever given?
Oh, gosh. In financial, biggest or size?
Both, I guess. No, probably size. That's a big hint. So you don't have to answer now.
I'm thinking royalty, and I would think, say, a castle or something.
Okay, fine. Well, we'll do the answers at the end. I'll let you worry about it for a bit. Or try and frantically Google on your phone.
You know how competitive I am, so this is going to destroy me if I get all of these wrong.
Oh, it's okay. Don't worry. I got them wrong, so. Second question.
That makes me feel better.
Second question. What is the largest grossing Christmas film of all time?
Oh, I want to say Elf because it's my absolute favourite, but I don't think it will be. I think I'm going to go Die Hard.
Oh, yes, you've admitted that Die Hard is a Christmas film. Anyone who knows me, I always say it's a Christmas film.
It's Christmas when the plaza gets attacked.
Yeah, Snape doing horrible things. Right, question number 3. So according to online.firstaid.com, what is the 4th most common accident at Christmas? So out of an allergic reaction, alcohol-related, choking, decoration related or fairy lights?
Oh gosh. So I would say choking is really high up there, because obviously everyone's eating a lot more than usual around Christmas time. Alcohol, I also think, would be very high up on the list,
Okay.
especially if you're with my family. I don't think. Or see, the competitive
I
one
know.
in me is like, are you talking specifically about Christmas Day?
I don't know. I didn't look into it that much. Don't worry. Have a think. You've got your options. We'll come back to it at the end. And obviously, anyone listening, you could be screaming at Joe telling what the answer is. But
No, do you know what? I'm going to commit to it. I think I'm going to go choking.
okay, fine. We don't have any 50-50 or phone a friend options for this quiz. So.
Oh, that's a shame.
So question number 4. So out of our podcast so far, so we've had 26 episodes. Which episode has had the most listens?
Oh, I should know this. Which has had the most listens? Okay. I'm going to go with Dr. Liz O'Riordan because she has a huge following, and I know that she obviously appeals maybe to a wider demographic of the audience, because healthcare professionals will want to listen to it. But then there's Rachel Moses' leadership. She's very inspiring. Lots of people know her.
And she continued to do the whole podcast while having an allergic reaction.
Yeah, absolutely. Crab sticks are us. Yeah, don't ever give Rachel Moses a crab stick. She is allergic. Yeah, I'm going to go Liz O'Riordan, but I might kick myself.
Okay, right. Well, we'll come to it at the end.
Okay.
So yeah, I mean, we'll go on with everything else we wanted to discuss.
Okay.
Unless you want to know the answers
fine.
now.
I kind of do.
All right, fine.
But yeah, go on. Give us the answers because I can't wait, name.
Okay, so the largest Christmas gift ever given was the Statue of Liberty.
Oh, I should know that. I've been to New York. They would have said that on the tour, I'm sure.
Probably. So the largest grossing Christmas film of all time was Home Alone, or is Home Alone. The first one, which is definitely the best one.
Yeah. Yeah, without a doubt.
So for the third question, I kind of gave you the answers in order as they were. So, yeah, allergies is the most common accident at Christmas, then alcohol, then choking. So the fourth is actually decoration related. So putting your Christmas tree up or something. And then fairy lights is number 5, which, I mean, yeah, I don't know how you do that, but it's impressive.
Electrocution.
Yeah, could be. So number 5, so which episode has the most listens? It's actually, so before we moved on to one of our softwares, so having like tallied it up, so Shireen Pavaday, hers one, is almost, I think they're about similar with Liz. So both of those are the number ones. And the ones that, the episode that's had the most listens in one day, I think was almost around 150, and that was Steve Bland.
Brilliant.
So yeah, there you go.
Oh, and really, I think I speak from both of our perspectives. We have been so lucky to have such amazing guests. For anyone who kind of doesn't know Naaman and I, we don't harass people, but we do ask people, and we kind of know in our head who could make a real impact and obviously highlight the profession most, and you know, even from our own perspectives of having people who influence us and are inspiring to us. So I know Charlotte Beardsmore, Heidi Prost, Amanda Balderson, they're all people within radiotherapy world that you and I look up to and aspire to be like. And from that perspective, I think it's important that we share that, but also looking wider afield and thinking about some of the audience members. If we've got oncology nurses, we've got oncologists, then it is great to be able to kind of bring lots of different people onto the podcast. So we're always up as well for people suggesting who could potentially be on. So we do get some emails, don't we?
We do, yeah.
From people going, oh, you need to invite this person on. So don't ever feel like you can't contact us.
Yeah, and it's as Sarah Lianage, to make sure I pronounce it correctly, she said that actually as a patient, hearing our stories and our experiences and examples from the other side for patients is also valuable, same as it is for us to listen to them. So I've really enjoyed those as well.
Yeah, it's really important, isn't it? And I think it would be great if we could appeal to a wide audience and have a bit more of a collaborative experience between patients, healthcare professionals, carers, relatives. I think, again, sharing all of those experiences together in this forum platform, it can really help and make a difference. And I certainly enjoyed talking to patients and learning about their experiences. So I think one of the big things to think about in terms of our achievement over a short period of time, Naaman, was the CPD accreditation with the Society College of Radiographers. So I know that was something that, obviously, coming from an educational background, it was always going to be top of my agenda, was thinking about how we could utilise the podcast for CPD. And I think it is really important. I don't think we have huge engagement yet from the audience, which I think is telling of the current status of the NHS, maybe from healthcare professionals struggling anyway just to get through work, let alone thinking about CPD. But HCPC audit is coming up for some of our radiographers, diagnostic, therapeutic, some of our allied health professions that listen. So using the podcast could be a real advantage. And I think it is a different way to do CPD. Did you ever use podcasts previously to do CPD, Naaman?
I think the You, Me, Big C podcast, I listened to that a lot when I was going on quite long runs. They're really good conversations. I would learn quite a lot. I've never used it at CPD, to be honest. I think both of us do quite a lot of continual professional development as it is, but never really thought about a podcast. So it's on the go. You can pause it, go back to it. And as we've been kind of engaging with our audience and guests in a way and having the CPD reflection points, it's really nice. I know I've had a few kind of people who I've worked with before who've said actually it's really good. It just gives you something to think about.
I think a lot of people do the continual professional development, but as you say, on a run or on the go or just listening. So mentally they're thinking, yes, I'm going to use that in my practice, or yes, that's something I can consider doing. But I'm not sure how many actually use the reflective questions. So it would be really good to start to kind of get people to engage in that way. I think using it as formal CPDs is important, really, to make sure that you're capitalising on some of these opportunities, especially where you have got patients sharing their experiences. So it's just a plea, really. If anyone's bored over Christmas, have a look at previous podcasts and have a look at those reflective questions. We obviously share all the links to research and resources that are talked about within the podcasts. And I certainly know, from our perspective, we always plan ahead of guests coming on. So it's never just, although it might, I don't know, from an audience perspective, they might just think, oh, Joe and Naaman just have a chat. But we do read all the literature and stuff that guests suggest that they might talk about. And that's huge CPD. And I definitely have learnt lots over the last 2 months that I wouldn't necessarily have engaged with in my normal day-to-day job. So
yeah, we love a stat, don't we?
Yeah, we do. Absolutely. So by all means, it would be great to see more people do the reflection. And you get an amazing certificate. Who doesn't want a certificate to add to their CPD portfolio?
Exactly. You mentioned about the impact earlier. I think we've both got quite a few examples, haven't we? But I think one for me has been sort of people reaching out from across the world. So through social media or emails, just saying that you've had this as a topic. So let's say some of the sexual care series that we've had, and actually we've never considered it in our department, but now I'm taking it on to work with the senior, or if they are the senior, that actually this could be a new project for us to look into in the new year. So that's quite nice. That's a good bit of impact on an area that is quite a hot topic anyway, but something that hasn't really been addressed enough. So, and I think a few people have reached out, and we've been able to kind of signpost them on to some of our guests as well, haven't we? So, and I know,
Yeah, we do get patients, don't we, who contact us via social media platforms, and obviously Naaman and I will refer patients accordingly. It's not to say that Naaman and I are experts in all of cancer treatments, but certainly we have really good networks and we have really good knowledge of who to direct patients to, and sometimes that's just as important. So I feel really passionately about being able to do that, and it's nice that patients feel that they can contact us, and that we're approachable and accessible, because as we both know, every contact counts. So it doesn't matter whether that's over social media or whether it's in the formal setting of clinical, or from my perspective through the students that I educate. So I think that's a really important aspect of the podcast that I don't think I necessarily considered when I started. I know you and I do it through Radiotherapy UK, but I think that's slightly different. But I certainly have been surprised at how many patients or carers or relatives of patients contact us. But it's reassuring from that perspective.
yeah, and as I said, like everything we've discussed and the actions we take, we're kind of hoping will give people, so healthcare professionals or just anyone listening, just the confidence to take it forward. Even if it is, you know, when you talked about your experience with your grandma, when we talked to Steve, just that open and honest conversation about what do you want at the end. I think it's just really important.
Yeah, I think I'm a bit of an open book anyway. So I, like, anyone who knows me knows I'm, you know, tell everyone everything. I've probably got no secrets whatsoever. But I do think it is really important, and something that I am definitely really passionate about, which is talking about death, dying, and people's wishes. And, you know, all of my family always laugh about the fact that they know, even now, what it is that I want. But I think those conversations are really important. So even if we spark a conversation with people about any of the topics that we've covered, I think that's also really inspiring, just to think that it's opened doors that people wouldn't ordinarily have opened previously with friends and families and relatives.
Exactly. And so one of Charlotte Beardmore's top tips was about using our protected titles as therapeutic radiographers. I remember when we first met, I called myself a therapy radiographer. You messaged me privately and said, excuse me, that's not right. And I even got my name badge changed because that's what it said on it. So
yeah, I think that's definitely something that Hazel Pennington and I are really proud of, in terms of how we were able to just almost get a bit of a reputation for challenging our title name. And it's not to say that I'm in love with being a therapeutic radiographer. You know, I'm sure that actually there's other titles that I think maybe we should be called. And I know Charlotte alluded to that as well. But I think we have to use our HCPC registered title for so many reasons. And I know now, being on social media, on Twitter, and having more followers through RadChat, I do see lots of therapeutic radiographers who have on their kind of bios therapeutic radiographer. And I do always feel a bit like, oh, am I overstepping the mark when I go, just dropping you a little bit of a DM to see whether or not you'd consider changing your bio. And a lot of them are like, oh yeah, absolutely. But in our department, we're called. And I'm like, you need to be that kind of voice of reason to say, let's change it. And I know that Hazel and I did manage to change the whole department changed name badges and things. And I feel really passionately about that. We should be proud of who we are, but we know, don't we, that recruiting to the profession, acknowledging the profession, you know, even on Twitter today, Cancer Research UK produced an amazing piece about radiotherapy, radiation therapy, proton therapy, and it mentioned lots of professors and some oncologists, some physicists, no mention whatsoever of therapeutic radiographers, and yet lots of the imagery was around linear accelerators, proton treatments, and there were therapeutic radiographers doing the treatments, and there was just no mention of it. And we get forgotten in things, not even just media, we get forgotten about in government guidelines. So I think that's why it's so important, and something that I am really passionate about promoting. You know, all of my students get pulled up in their assignments when they start saying, "Oh, as a therapy radiographer," and I know why it is. It's because of the fact that they're working in a clinical department where they use that title.
I think it's the word count as well when it comes to an assignment.
Yeah.
That's valuable characters, Joe.
Well, you can abbreviate. You could put TRAD. I don't mind that, as long as you appropriately academically write it. But yeah,
I think it's something, you know, with so obviously you came on a while ago for a podcast with Hazel and Shannon Johnson as well, and then that's kind of stemmed into you co-chairing now the Promoting Radiography Special Interest Group with the Society College of Radiographers. That's something, you know, Shannon and I have done a lot of STEM work, so outreach work about being therapeutic radiographers, what radiotherapy is, you know, taking a head and neck mask, which is quite visually representative of our profession. It's not the best experience for patients, but unfortunately, while we're still not very well known, it is a good way to show patients, or just anyone really, what to expect. Because people, if you know what radiotherapy is, you will have seen a head and neck mask at some point. But it's then, you know, the IPEM, I can't remember the full name, but they have got those little linear accelerator toys. So using those to take into schools just to show, so like a Lego thing. It's very simple, but it's a really good visual representation. But that's something, you know, especially from what we're doing now, constantly talking about us being the first therapeutic radiographer-led podcast, and in an oncology setting where we've got followings from UConn, some, you know, oncology registrars, etc., and we are expanding our outreach even further across the world, where maybe the role of a therapeutic radiographer or a radiation therapist isn't quite the same as it is here. I think it's really important to showcase what we can do. So obviously the diversity between both of us, our backgrounds, what our roles are, like what I'm able to do compared to some of my colleagues, like it's amazing that, you know, we can get this far. As you said, we just got to keep shouting, keep messaging people.
Yeah, although my son has also put a bit of a caveat. So he used to go to children's parties, and he would always have the present, which was always the IPEM Lego linear accelerator. And he's now like, no more, mum, no more. They've all got one. Nobody plays with it anymore. Give me some PlayStation vouchers.
The best thing about the toy is it covers the diagnostic side as well, because you can turn it into a CT scanner.
Yeah.
So, you know, maybe you should do that next time, so you can talk about diagnostic colleagues.
Yeah, maybe. I don't know. I think when I give him the choice of Lego or a PlayStation voucher, I know what he's going to go for. But yeah, let's all keep just promoting our profession, because I think it is really important. And also just with patients, we know from having patients on, like Liz said, didn't she? Never even knew what therapeutic radiographer was, and she was a breast surgeon in oncology. Scary, really scary. So yeah, it would be brilliant to be able to kind of have that, not recognition, because I don't think we're doing it to have anything. It's just making sure that people know that we exist.
Yeah. And obviously,
you know, when you talk about allied health professions, often people will think of physios and occupational therapists.
Yeah. Sorry, Rachel, we're here as well.
Yeah.
But I think it's great to be able to, you know, speak to someone like Liz, or even like Steve, people who may know of our field, as you said, but not in enough detail, and just discuss what we can do, and then using their platform, they can keep shouting.
Yeah, really good. So, we were thinking about some of the top tips that people gave us. Naaman, did you have any top tips that any of our guests gave that you think you've utilised in your own practice now?
I think I'm sure you'll probably agree, everything we both do is around the patient voice anyway, but lots of the conversations, whether it's equality, diversity, inclusion, you know, the workforce development stuff, everything has just been around trying to link it to patients. So some of the sexual care series, where I don't think maybe before those, maybe like talking to Sam, I wasn't as confident as maybe a young male therapeutic radiographer to have these conversations with, for example, breast patients or gynae patients around sexual care. But just hearing some of the things and like maybe just some of the passion that Sam had for, the impact that she hopes for, that will, not quite change, but probably improve practice. And then, yeah, just taking that forward and then getting sort of patients reaching out and saying, look, no one's ever discussed this with me before, but thank you. I mean, it's surprising that it's the male therapeutic radiographer doing it, but yeah, thank you so much. I've now, like, I might not have all the answers, but being able to signpost on to someone like Sam, or yeah, like discuss some of the topic areas that sort of Lauren and Will mentioned as well. And I think I've learned so much, as you said, just with every podcast that we've done, even, right from number 1 up to number 26, every single one, there's something new that you can take forward. I think the power of social media, was never a fan that much of social media, but actually now where you can engage with patients in a sensitive way and signpost on to support them. So what we do with Radiotherapy UK, or with my role with Move Charity and 5K Your Way, so around exercise, like that, yeah, just the impact you can have from just sending an article over. So for example, if a breast patient has reached out, and then sending over the Respire project, or the Society College of Radiographers, the skincare leaflets that have been produced. It's just, yeah, it seems so simple, but it can have such a huge impact on a patient's life, or just anyone's life, really. So yeah, what about you, Jo?
It's similar, really. I'd say everything that I learn, I obviously use that learning to filter into education. So my own development, my own extensive knowledge is impacted by patient voice. So I know already people have commented on the fact that diagnostic radiographers are now going, I'm definitely going to suggest gloves for when patients come for treatment, or we've had therapeutic radiographers going to say, yes, actually we are going to make sure that they talk about it is cold, and maybe you might want to wear something over your arms and things, or using a blanket. So it's little things like that I think is really important. And I think because I'm in education and I get access to lots of students, and not just radiotherapy and oncology students, it does feel like things that I pass on through some of the education could hopefully make an impact. Don't always ever know how much of an impact it makes, but that's what I aspire to do, essentially, is make sure that people at least consider it, or they have something in the back of their minds that makes them think, actually, I could maybe change this practice. And I know from some of the guests that we've had on around changing practice, improving practice, developing practice, in response to things that aren't quite right. I know that Dr. Richard Simcock mentioned about, if you know something's not great, change it, or at least go with an idea to management. And I think that's really, really important. And I know that's something that we really advocate through education, that all higher education institutes kind of collectively push for, is that the evidence-based practice and, making a difference. That's why we teach our students all of the methodologies around research, audit, because it is so important and can make a real impact and change. So
Yeah.
I think that's the big thing for me.
I think just to close off onto that was what you said about not always seeing the impact. You don't always see the impact, do you? I mean, we don't go into this sort of profession in healthcare you want to help people, but you don't want to be getting a high five every time. It's what we discussed with Ben, wasn't it? That inner applause, knowing that in the moment you have done everything you possibly could to help someone. And then afterwards, if you get something for it, fine. If you don't, just give yourself an inner fist bump or high five. Move forward.
Yeah, absolutely. So I think we're at a good point now, Naaman, because I know we could talk for hours. But we're at a good point to formally announce now, although contracts aren't yet signed, but we've got the go-ahead to make the announcement that we are officially going to be sponsored by OSL. So it's amazing, and something that we really did want to happen, largely because Naaman and I do all of this in our own time, and financially it's been quite expensive to start a podcast. Who knew?
Yeah, we're a startup.
But yeah, just Yeah, absolutely. So we're not getting paid for anyone out there going, I'm going to do podcasting to make money. We're definitely not there. But hopefully the sponsorship will help us pay for the platform that we've had to obviously pay for, and some of the social media platforms and things. So thank you so much to OSL for taking a leap of faith, because there's nothing quite like us out there. And so obviously from that perspective, they're trusting us to hopefully deliver something. But yeah, I'm really excited. I'm not sure I ever thought it would really happen, but yeah. Exciting. So thank you very much, OSL, and we will obviously be promoting them through some of our podcasts in the new year when all the contracts are signed and sealed. So that's really exciting. So Naaman, we've got big plans for next year, haven't we? I think we've used the Radvent calendar to somewhat advertise some of the guests that we have coming on, but amazingly, if you've not seen any of those posts, we've got Linda Thomas, so that she's the CEO for Macmillan. We've got Dr. Rachel Harris, so for anyone in radiotherapy and diagnostic radiography, they will know the inspirational Dr. Rachel Harris, who's going to come on and actually talk about patient voice. And then, do you want to talk about some of our guests?
I think one I'm very excited for is Dr. Catherine Mannix at some point next year. I've read her books. Yeah. I think I'm reading With the End in Mind again at the moment, just because I loved it so much. Then we've got Jemima, so from Trekstock, the charity. So charity aimed for kind of younger patients. So I think it's 18 to 39. I might have got that wrong, but some fantastic ambassadors there. And there's a couple of others that you've got in, haven't you, Jo?
So we've got Dr. Sarah Hayward Small. So I work with her actually at Sheffield Hallam University, and Sarah's amazing. So she's done lots of work around mesothelioma cancers, but her knowledge around biomedical science is amazing. So I'm really excited to get her on. And then my old boss, so June Davis. So I'm hoping that's not a bad thing to invite your old boss on the podcast. I don't know what she might
she said
say.
Yes.
But June Davis, June Davis is the AHP lead for Macmillan. And then you've got some exciting guests that you've got on through your work.
We've named quite a few. There are a lot more than that. There's about 25, I think, plus. So we've got a busy year. But yeah, just the last couple to talk about is Gemma Hillier-Moses and Dr. Lucy Gossage. So Gemma founded Move Charity, and then they both founded 5K Away. So just basically getting cancer patients before, during and after treatment back into exercise by just doing a 5K your way, whether it's crawling, walking, running, sprinting, whatever it is. So I'm the London Healthcare Professional Champion. It's quite a long title. I always forget it.
That's a big
Imagine that on the name badge. So I do a lot of work with them. And actually having a chat with Georgie Freeman, the operations manager yesterday, they're actually going to be endorsing us too for this, and they've got their own podcast as well, which is amazing. So it'd be great to have them on. We both talk about exercise a lot. We're both quite competitive, so it's good to talk about exercise with our patients, and that would be a really good podcast to have in the future.
Brilliant. Yeah, lots of exciting things to come. So thank you to our amazing audience for sticking with us. And hopefully we don't disappoint in the new year and we keep up the momentum. We're hoping to average out eventually, because we've got too many guests to do this at the start of the year, but hopefully at least one a week. So make sure you all subscribe on the website or on your particular platform that you listen to the podcast.
I think for January actually we've oversubscribed and we've got maybe almost 6 times that, but there you go. We're enthusiastic.
Our evenings are going to be busy.
Yeah. Well, anyway, thank you to everyone who's been listening to Rad Chat. So this is the Christmas special, and so your hosts today have been Naaman Jorgensen and Jo McNamara. Jo, it's great to have you on. Thank you for everyone for listening. We're going to take a short break until the 4th of Jan, where we will be catching up with a wonderful lady called Ayana Butt, who's coming on to discuss her cancer treatment experience and how she is raising cancer awareness, especially around breast cancer within the Southeast Asian community. So happy Christmas and New Year to all of you and to your families.
Happy Christmas. I'm going to shake
Happy
my
Christmas.
baubles.
I'm going to shake my baubles at people.
Good, well, we'll leave it at that. That's our jingle.
Yeah.
Bye.
Bye-bye.